So I'm learning good medicine in extremely highly resourced environments. And yet I know that I want to go work in places where there's no electricity, there's no running water, there's no clinic half the time, or there's no blood pressure cuff. Whereas in America, you could, let's say, order a Chem 20 to check the electrolytes. And maybe let's just do an extra CT scan or MRI just to check whether that's not broken. Whereas in Africa, there's, some countries have no CT scanner, no MRI machine, or one radiologist in the entire country. So I knew yes, I'm learning great stuff, but it's not going to be really applicable to what I want to work on in my professional life.
Where lust for a whole life and nothing but less makes people jump out of a comfortable pond into an unknown ocean. Welcome to that journey between the East and the West. Who says rolling stones don't gather moss? Hello everyone, I am Meenu Gupta, your host for the day, and I'm delighted to have you join me every week as amazing people share their incredible and inspiring life stories of straddling continents. Thank you.
We are living in a moment where health is no longer only a medical question. It is a question of leadership, of systems, of trust, of technology, and ultimately of justice. And in my opinion, across the world, from the global south to the global north, we are asking the same urgent questions. How do we build health systems that actually work? How do we move from innovation to impact at scale? And how do we ensure that progress reaches not just a privileged few, but entire populations? Today's guest sits precisely at that intersection between medicine and management, public service and private innovation, policy and practice. Dr. Ernest Darkoh is not someone who speaks about transformation from a distance. He's someone who has built it on the ground, under pressure, and at national and international scale. So from being felicitated as a global health hero by Time magazine for his leadership in launching Africa's first HIV public sector treatment program in Botswana, to shaping long-term sustainability models for millions of people living with HIV, Ernest's work has quietly redefined what is possible when clinical excellence, systems thinking, and moral urgency come together. As a co-founder of Broadreach Corporation and a member of multiple boards, including that of Global Development Incubator, I find that very interesting, Ernest, by the way, and earlier member of the Advisory Council of President Obama, he has spent more than 2 decades working across 30 countries, supporting governments and institutions, and turning delivery strategy into delivery and delivery into lasting systems. But what makes this conversation especially timely is this. Ernest is now deeply focused on how emerging technologies and innovation can strengthen health systems, not as shiny solutions, but as tools for equity, resilience, and scale. And that is why, my dear listeners, Ernest has been invited to our platform today, because we are at the intersection of shaping public opinion as well as shaping policies and humanizing topics. And I loved the idea of what Ernest has been doing across the globe. So thank you so much for being here today, Ernest. Can I dive in?
Yes, please. And thank you for the very, very kind words and nice introduction.
It's amazing work you've been doing. It's very impressive. So I do look forward to the next many minutes of our conversation. You've trained as a physician, worked in management, consulting, and could have chosen many paths. What was the moment of realization that made you commit your life to building health systems at scale in one line. How did this start? Because it began as a seed somewhere.
Two moments actually really, I think, coalesced into this decision. First was I was, I think, in my third year of medical school, and at that time doing rotations through the Harvard hospitals, and realizing as much as I loved medicine and I loved my patients, what I was learning was not going to be applicable in the environment where I'd grown up and really had wanted to spend my professional career, which is in Africa and other emerging markets. So I'm learning good medicine in extremely highly resourced environments. And yet I know that I want to go work in places where there's no electricity, there's no running water, there's no clinic half the time, or there's no blood pressure cuff. Whereas in America, you could, let's order a Chem 20 to check the electrolytes. And maybe let's just do an extra CT scan or MRI just to check whether that's not broken. Whereas in Africa, there's, some countries have no CT scanner, no MRI machine, or one radiologist in the entire country. So I knew yes, I'm learning great stuff, but it's not going to be really applicable to what I want to work on in my professional life. So that was the first moment of that realization that, look, and something felt wrong. And at that time, I didn't have the language for it. I didn't have the language of, I want to be a doctor of systems, not just of individuals. At that time, I still didn't have that language. But then when I did my Master of Public Health, this was the second moment that ultimately sort of really sealed the deal. Was after lectures one day, a pharmaceutical company had just presented, and as usual, our class went after them, criticizing them, and private sector, evil, the evil empire. And I remember sitting there in class saying, so we talk a good talk, but if somebody handed me $5 billion and said, here's a country, fix it, what would I do? And I realized I did not have the first clue of where to begin. Do I put that money in my checking account? Just very practically, what steps you take, to fix a country. So that's what ultimately, when I realized I really need to do this completely differently. I don't have the skill set I need to actually make a difference. I need to learn about what makes things tick, meaning what makes institutions tick, money and human resources primarily, right? And where would I learn about that? Where would I learn how these things work? I felt I'd learn more about that by going into private industry for a while than I would seeing more patients in the hospitals. So that was my foray away from medicine for a while and away from public health for a while, where I joined the corporate world, worked in management consulting for a McKinsey & Company for a number of years, saw a lot of business models. How do you set up processes to deliver outputs and outcomes, right? And how do you practically do that by managing money, managing people, organizing them within the right organizational structures in order to accomplish particular ends and means, and really understanding how do you drive process to outcomes. And then from there, I ended up coming back into public health then full time. That was almost over 25 years ago. And at that particular point, I was recruited then to lead Botswana's national HIV program, which was a real put your money where your mouth is experience, because it was an unprecedented program for the African continent at the time. And I found myself through a very interesting story in charge of that. I hadn't actually gone to be in charge of it, but ended up having to basically set up the program from paper concept to full countrywide rollout. And that was a life-changing experience in and of itself.
That's interesting. Now, do share. You said it was a life-changing experience. Do share. And you said something very important. And you said you asked yourself a question. And I just realized probably that's where everything starts.
Exactly.
Anything that makes sense to the individual as well as to the other world later. It's like people see the baby later after it is born. That was the seed, asking the question, right question.
And if I was to almost like say, look, we could end this conversation right here, that would be the headline: ask the right question. Right? Most people don't ask the question, or they ask the wrong question. And often the departure point from where we start is completely off and no one realizes it. So for me, I've always asked myself those questions. And for whatever reason, I've had the ability to always just be honest with myself about, for example, is this really making a difference? Is this really the problem, right? And making sure that I'm always asking the right question and then answering the right question in the correct way. And then after that, only looking at things like, well, can technology enable this, et cetera, right? But often we just always, here's a technological solution. And then we try and apply it to things. And often it wasn't really relevant to what needed fixing. So yeah, to pick up on the Botswana story, I'd been at McKinsey for a number of years, and I guess internally, I just felt like I want to implement. I don't want to just leave people with advice and then look back a couple of years later and say, see, they didn't do what we said, and that's why it didn't work. So I was itching to implement and really do on the ground as opposed to simply advise people on doing. And so when I was pulled in initially as part of the pro bono study, which McKinsey did for the country of Botswana to assess whether it was feasible to launch antiretroviral therapy for their population. So this was year 2000. At this particular point, Botswana, I think, at that point ranked as the single worst prevalence country for HIV in the world. Almost 40% of women of childbearing age were infected. In some of the mines in Botswana, 75% of the workforce were HIV positive. And rightfully at that particular time, the then president, Festus Mogai, did say that the country is facing extinction. Because when you look at the age demographic that HIV hits, which is your sexually reproductive age group, if you knock out that group, all you have left are young children and very elderly people. Now, at the time I got to Botswana, I think the life expectancy had fallen to something like 35 based on HIV. And I remember not being able to run my office effectively because of the number of funerals people had to attend, and attending graveyards and seeing fresh graves as far as the eye could see. This is in a tiny country at the time, population less than 2 million people. So rightfully, the president was like, look, I need to see if I can treat my people. And this was controversial, by the way, because this was against a global policy position at the time, which said there should be no treatment in Africa. It should only be prevention, because treatment is too complicated. And if we do treatment in Africa, because it's so complicated, people won't be able to be adherent. They'll set off the next resistance bomb. That's going to become now the next problem for the world. So for like 20 something years, they maintained this ridiculous policy position, actually. These are the major normative agencies supporting it, saying that there should be no treatment on the continent. And of course, in places like Botswana, and then Swaziland overtook us and went to 42% prevalence shortly thereafter. You just showed the disastrous consequences of such thinking. And in Botswana, at that particular time, the country was a very wealthy country. They had a credit rating better than Japan's. They had billions of dollars in reserves because they're sitting on the world's largest deposits of high-quality diamonds with a relatively small population, although the country is the size of Texas. And they were like, why can't we treat our people? Right? What's so magical about this treatment that we can't do it when we treat everything else, and we find ways to treat for everything else? And so at that particular time, we're probably still looking at a cost per patient just for the medications of about $10,000 a year per person. But Botswana could afford it. And part of the consultancy I did with McKinsey really bore that out, that, look, you could actually, for the number of people you need to get on treatment in Botswana, the country could sustain that on an ongoing basis, on their own budget. And no, this was long before the big HIV program started, like PEPFAR or the Global Fund, et cetera. In fact, one of my team members went to help the first founder of the Global Fund to actually get that set up. So when I arrived in Botswana, right, we're doing a first of its kind experiment in essence, where there's been no treatment for like 20 something years. Therefore, no doctors had the experience of treating people with HIV in the country, or nurses. So we had to train everybody on how to do that. The population, who largely, when you look at the rural population, who are not English speaking, have to be educated on what is a retrovirus and what is the difference between treatment versus cure, for example. Because in general, in most of the Southern African languages, there's no word even that distinguishes treatment from cure. The word that they have is basically cure. You'll be cured. So we're trying to distinguish this. And this is why I can understand also challenges with other chronic medicines, like blood pressure medication. So here's something you have to take every day despite the fact that you feel well. And that concept is really hard to translate of why should I take this when I feel well? And you'd see against a backdrop of other chronic diseases, for example, like hypertension, where even university professors will tell you things like, I only take my pills when I get a headache. So that concept of really understanding why you maintain it is a big deal. And you have to educate the entire population in the multiple local languages. And you're trying to educate them on scientific concepts and biological concepts like a retrovirus and how that works, and et cetera, and why you need to take the medication. So there was a lot of work to be done. We did not have any equipment in the country for lab testing, et cetera. We had to buy that, make decisions on it. So we did everything from building actual new physical facilities, clinics, buying lab equipment and putting them in there, designing the criteria that would be eligibility criteria for patients to initiate therapy. So we are the ones who came up with the let's start at a CD4 count of 200, right? After having consulted many experts, that's what we landed on. But we had to make that decision there was no prior precedent for this in Africa. We had to set up IT systems to monitor patients. We had to negotiate the drug prices with the drug companies. We had to figure out how these drugs got stored and distributed in rural clinics that, if you're lucky, sometimes had a little tiny mini fridge packed with other medicines already. So where you're going to store your antiretrovirals, or in particular the pediatric doses, which were liquid. So these are the things we have to figure out from scratch, right? And on our own. And so when I arrived and was asked to take over the program, this was where it started, in a program where, by the way, everybody thinks that because it's HIV or tuberculosis, that therefore you should hire a doctor to run the program. But all these things I've explained, figuring out supply chain, figuring out infrastructure, human resources, training, that's not a typical doctor skill set. There's zero training on that in medical school. And so you'd have to actually either, like myself, leave medical school and study and work in different fields to learn this stuff. But most typical programs would hire a doctor to run these things, who again doesn't know what they don't know, and therefore often they come in charge of these programs and flounder. So what ended up, in my particular case, was luckily I sort of knew what I didn't know. And so I knew I need particular skill sets that I need to bring onto the team. So it was a really innovative team. Here was a typical government program who brought in a project manager from the private sector. And I brought in then a few other key private skill sets, like a social marketing person, an IT person to deal with the IT systems. I brought some private sector doctors to deal with the training. We brought doctors in from all over the world to help train local doctors on the ground on a rotational basis. This was a sort of a real unprecedented structure. We were all this one team was accountable then to ultimately the president and cabinet for setting up and delivering this program over time. And my role and the team's role was funded by the private side of the team, funded by the Merck and Gates Foundations, who underwrote part of it and also provided some additional funding to help with the scale up. But I'd say 90% of the money really came from the Botswana government for this program. So the fact that the Botswana government would allow a public-private partnership of this nature, where they're really providing real accountability to the private sector side of this, real joint accountability, which is jointly monitored both on the Merck and Gates side and on the government side. And on the government side, including periodic reports to cabinet. It was really unprecedented. And they set up a governance structure which included the key permanent secretaries of relevant ministries, the Merck and Gates Foundation leadership as well. And that was the overall structure that oversaw this program. So this was really, truly quite unique. And it worked. It really did work. I mean, we were able to get this program off the ground. It was initially a very slow start. A lot of people didn't understand it. We had a lot of criticism. In fact, when we started the program, we got a lot of cease and desist because of the quote unquote, the global leadership, the global normative norms, and we shouldn't be doing treatment. So I was called by quite a few entities and told, you should not be doing this, it's irresponsible, which increased the pressure to be successful, right? Because if we had done it and it was a failure, this would have been a disaster. I would have proven them right that, see, we told you not to do it and look at what's happened. So we had to overdo it in terms of making sure that this thing really worked. But our team worked 24-hour days almost to pull this off. And we were able to basically get the program off the ground. I oversaw the first 5 years of implementation of the program through to implementation in every hospital in the country. And then I left just as We were doing the rollout to all the clinics, but we had already set up a plan for that before I left. And in the middle, I'd say 3 years into our program is when PEPFAR and the Global Fund started. And that's when a lot of other countries, I think, who previously believed that all we need is the money and we can do it, all of a sudden had the money and realized it's a lot harder than they thought. So they started reaching out to me in Botswana saying, with basic questions like, how do you train your nurses? Is a 1-week course enough or do you need a 6-month training course, right? So all these very fundamental questions you face when you try to do it on a Monday morning. And we had the 3 years of experience of trying to do this. And we could share, well, this is what we tried. We tried these 3 ways of training, and this is what worked and this is what didn't work. What analyzers do we use? Do we do central testing or point of care testing, and the pros and cons, and the particular analyzer you bought, by the way, does that work or not? And would you do it again? So we could share these experiences with the world. And that then became the jump off point or the departure point or the springboard for then forming my own company with my best friends from medical school, Dr. John Sargent. So when all these countries were asking for assistance, I approached the Merck and Gates Foundation saying, look, I was only supposed to be here 1 year initially. Now we're going into, year 3 or 4. Clearly, you want me to be here to oversee this rollout for the full duration. This is my second job ever in life. I'm not allowed to make more money than my boss, who I report to in the Ministry of Health. I've taken a big pay cut to come do this work. I can't get a title change. So I said, let me form a company and I'll still give the country 90% of my time. But with 10% of my time, I can at least begin to assist these global initiatives who are asking for assistance in various ways. So luckily they agreed. So I turned them from being my employer into my first client and then began to grow other clients from there. Next, at that particular time, because PEPFAR had started, we did our first PEPFAR application for South Africa, which my business partner, John, wrote here in South Africa. We won an initial award here, and then we grew from there quite rapidly. So when I say it was a very unique experience, it was a very unique experience from the point of view that I had to deal with every aspect of the healthcare value chain, right? Every aspect, understand how it all ties together, orchestra conducted effectively, and ultimately deliver results, right? So it was really from paper concept, get everything lined up, run it effectively, make sure that the right results are coming out of the end in terms of suppressed viral loads for individuals. And by the way, all of this against the backdrop of being told this cannot be done on this continent. So the pressure was on us, but I'm happy to say we delivered. Some years later, Botswana was written up by The Lancet as having the best program in the world. I think they were maybe the first country to hit triple 95 UNAIDS targets also as well. So, it really became a country that defined a lot of firsts in the world. And from a precedent setting, I think it was important, given the backdrop I explained, where the world was very skeptical about us doing this in Africa. So for me, that became one of from a professional point of view, one of my most formative experiences that then enabled me to do a lot more, is truly coming at it from a point of view of real experience as opposed to theory, and always approaching things hyper realistically, asking the right questions to really understand what really is the problem before you jump into solutions. Becoming really good at asking the questions is probably 50% of the battle. But I think it's, in my experience, very underappreciated and underrated, because often people think they have the idea of what the solution is or what it needs to be, and then they gloss over anything that's inconvenient to that story because they're so excited about their idea or so excited about their solution. And logically, sometimes it's like, well, of course that's right. Of course that must be a solution. But if you actually had asked the right questions, you often would realize that's a solution, but it's not the solution to this particular problem that we're having. And often in my experience, I found people don't really want to hear the truth about what's really the real problem that needs to be addressed.
I absolutely agree on all the points. And thank you for sharing that. I'm going to go deeper into this because it was fundamental. It laid sort of the foundation of the future works that you did, which had not only a global impact, national, but I think it impacted not only your life, but millions of lives across the globe. So I'm going to go deeper because it was very interesting. From what I think, you married intentional, moral conscience, awareness with what you saw. And that led you to the right question, because the right question seems like a one word, one line thing. But the person who asked that question, it has to come from somewhere else. So even the right question has multiple roots. So
Yeah, exactly. Asking the right question is an art form. I mean, I think it's something I'm sure psychologists learn it really well, right? But it is not just I sat in a meeting and asked a question, or I put up a slide and people responded on a clicky thing and we saw the results of the slide. It is not that at all. I mean, asking the right question sometimes is observing for 6 months what is really going on, being a fly on the wall, as opposed to looking what people do as opposed to what they say they do, or even better yet, what they believe they do. Because often there's a big discordance between what they believe they do and what they actually do. And what I mean is, when you start getting to, for example, feasibility of pulling off an ambitious initiative, people will, for example, engage with a particular entity or a government or whatever and be like, yes, we're going to do this. It's the right plan or whatever. But if you put on that lens of being the fly on the wall and you really get underneath the surface and you realize, if you did a secret time motion study of people in this organization, they effectively work like maybe 10 minutes of real work a day, right? That strategy had no chance in hell of working, no matter how good the strategy, how good the solution was, because the culture is wrong. It's not going to actually be able to sustain that, right? So this is what I mean by often people don't want to hear the real answer. They don't want to hear the truth that this is dead on arrival because it will not work in this particular organizational culture. They don't have the discipline or they don't have the wherewithal to pull this off. And that's why, for example, if you're going to do it, you need to bring in a partner who can do that heavy lifting, and you partner them up for their relative strengths and weaknesses. And doesn't mean it can't be done. It means it can be done, but you have to be then smart about how you're going to pull it off if you know that, for example, the main person you're expecting to get it done can't get it done. So you'll need to bring in people who can do it. But what I found is people often gloss over this, right? And will be like, oh, government, here's a program and here's millions of dollars for you to do it, and not realizing that's not going to work. And it's not their fault, by the way. It's actually not their fault, right? But it would be like me asking the elephant to do the 100-meter dash instead of the cheetah.
Yep, I'm so with you.
Or asking the cheetah to lift the 1-ton rock instead of asking the elephant, right? So that's the thing is, and often I find that power of really, truly observing, almost like radical observation, radical listening, radical looking is when people don't realize you're really looking, right? And then unpacking, okay, this is the reality I have to deal with. Now, based on, I need to marry this reality with this intention, and what's needed to bridge the gap between this reality and this intention. What do I need to do that? And therefore being able to bring in the right elements in the right sequence and cadence and to make that happen is important. For example, you mentioned trust at the beginning of the conversation, right? Sometimes I spent most of the first year just building enough trust with my boss in the Ministry of Health to let me do my work, right? Because I realized I'm a very atypical person coming to this role. I'm from the outside. I'm a foreigner. I was young at the time. And all the things that were like, you should not be in this job, right? And I remember really very funny interaction there. The first day, for example, I met my boss in government. His comment was exactly this, and I'll remember it, I think, till the day I die. He was like, oh, you have a very nice CV, but I can see you're still a child, right? It's like, nice to meet you too. But I knew, therefore, I had to build trust with this before I could begin to be effective, And often people come in like a bull in a china shop and, I'll forgo that and I'll try and bamboozle my way over that. But without me building that trust to the point where, in essence, he'd let me write letters in his name and send out communications under his banner and trust me to sign a document, sometimes without really even reading it, I had to earn that trust with him. I had to earn his respect as well. And I knew the day he gained that respect for me, right? Because it was a day when I realized that he was extremely uncomfortable telling interview candidates that they had not got the job, right? And so they would basically not outcome interview candidates because they didn't want to have that conversation to decline them. Right? And that had this terrible knock-on effect because you can't interview the next person unless that person has been declined formally. And so, of course, it was taking 2 years, 3 years to hire a person. And by that time, the person's not available. So you have to go down the list, and then you hire the worst individual. So I proposed to my boss back then that, you know what, we can interview and hire people on the same day. So what was taking years, I said we can do it in one day. We interview them, we give them tea and coffee, have them sit in a room, we evaluate all of them, we bring them in, and we tell them their outcomes, and we've got the person, and their contract is ready to be signed right there. Didn't believe it could happen. So we did it. And then I realized when it was time to bring in people to reject them, he was like really scared. You live in a small country where people don't take that as objective feedback, they take it personally. So wherever this person ends up, like they're going to remember I rejected them for a job and they're going to hate me. So there's a lot of paranoia about that. So I said, don't worry, I'll do the first rejections. And he was like more than glad to let me do it. Let Dr. Darko do the dirty deed, so to speak. And the funny thing was, interesting thing with human psychology is if you bring in somebody after an interview and say, simple question, how do you think it went? 99% of people talk themselves out of the job. 99% of people be like, I don't think it went well. They'll focus on all the things that didn't work well. So for those who you were rejecting, all you basically do is just agree with them. It didn't go as well as you thought, but here's some pointers of how you could improve next time. But definitely, please look, we'd love to see you again for other jobs that might come up, etc. Nicest interaction. They're literally hugging and kissing you. By the time they leave, you have a great interaction. And I could see after the first person walked out, my boss looked at me and was like, today I've learned something new. Right? It's like, I never thought this was possible. And that was the day I was like, I've got him. I've finally got him, in terms of him respecting me, right? And therefore allowing me to do a lot more, right? And so that's sort of one example. But a lot of that program, by the way, wasn't about quote unquote models or, here's theoretical frameworks of we've calculated how many doctors we need per patient, doctor to patient ratio, and then we've trained the doctors and they're going to see the patient. 90% of my work was really very behind the scenes things. For example, to make sure that escalations were working, right? When we needed to escalate something to the minister, that it was getting there. And this was a culture where no one escalated any real problems. You always tell the person above you that, yes, it's under control. So and here I am running the first treatment program on the African continent. I've got a hell of a lot of problems that I need to solve on a daily basis. And my boss would never escalate that up to the permanent secretary or to the minister. He'd always tell them it's under control. And so figuring out how to very creatively make sure that I could still get those things escalated through. I had to be really creative in designing mechanisms that, in essence, forced my bosses to escalate these things so that because I knew me just telling them, please ask the permanent secretary or the minister that we need the following, we're never gonna get it through. So I'd have to spend a lot of my time figuring out those things, figuring out communications. Government communication is notoriously dense. I'll give you this one example. People end up being shocked when they hear this, but this is the reality. So I was in the Ministry of Health, who own all the hospitals in the country. But all the clinics in the country are owned by Ministry of Local Government, right? And when you talk about reach and the entire population, there's many more clinics than hospitals where you actually have to implement the program. So local government actually is probably a bigger, more important stakeholder than even the Ministry of Health, where they just have the hospitals. Am I allowed to talk to my counterpart in the Ministry of Local Government? I'm the National Operations Manager of the program. I'm not allowed to talk to him directly. I'm not allowed to talk to this gentleman directly. I'd have to send a letter to my boss, Director of Health Services of the country, to say I'd like to meet with this guy. My boss would have to send a letter to the permanent secretary for this request of Ministry of Health. Permanent Secretary of Ministry of Health had to send a letter to Permanent Secretary of Local Government. Permanent Secretary of Local Government would then have to approve that I can meet with this guy. Send a letter back, by the way, saying that they're approved that I can meet with them. Then we're allowed to meet. And by the way, when I say send a letter, it has to be in writing. It has to be a physical letter, copy written, because email is not considered formal communication in government. So it has to be a formally written letter signed, and it has to be delivered through the government messenger mail system. those brown envelopes with the many different perforated holes on it with a cord that you tie, and the messenger has to go and deliver it physically in each place. And to give an example of why that communication trail I mentioned, for me to meet with somebody, to get the response would take maybe 3 or 4 years. Reason being, do you remember the day I mentioned I met my boss and he said I was a child? The first day I walked into his office, I walked in and I was like, oh, he's not here. And then I hear a voice and I look and he's sitting behind his desk. His in tray and out tray of all these communications, they were so high, I could not see him behind his desk. Until I walked right up to his desk and I could see below, he was sitting down there beneath these mountains of communications that all have to be paper done. And by the way, every Wednesday, he'd have to set aside the whole day to physically sign the medical licenses of every professional in the country. Whole day Wednesday, physically signing them. This is the way things worked, right? So when I say figuring out the comms to make this program work, it's not a small feat to get it to the point where I can get most things I need done within 24 hours, right? So this is what I mean by creative problem solving around these type of things was more important than any quote unquote, we got the drugs right or we got the training right, because the program actually moved based on communications, making sure district managers have received the right instructions, making sure that they've provided certain feedback, making sure they're being monitored effectively, and then making sure that the people who have the power of the purse and the power of decision making are getting the right information at the right time to make the right decisions and are able to take the right actions in a timely way. A 3-4 year communication cycle does not work, right, in that regard. And by the way, this is another reason why that public-private partnership worked. A typical government person would not dare break that protocol. But as a private person, I was like, no, I'm going to go meet with this guy. So I met with him, we became friends, we learned to trust each other. And then we said, look, we're going to meet, we're going to do the following things, and we're going to start working on them. And we'll write the letters to each other asking to meet. We asked permission to meet. But we're meeting and we're getting this program going, right? So I had to make those type of alliances with all the various people. And again, it was based on trust, that I'm not going to go and let them down and they're not going to let me down because we're going off the reservation here to operate in this manner. But that took a private sector person who wasn't encumbered by all of those government rules and regs to be able to do that kind of, I'm just going to go meet with the person. I'm going to text him on his phone and I'm going to meet him. Or I'm going to wait for him in the parking lot because I know where he parks in the morning and I'm going to ask him to sign my document. Or even my boss for that matter. Lots of things needed signature. And remember, you were sitting behind those piles of things, all needing signature. So how did I get mine signed? I knew where he parked his car. I knew where I'd meet him, pretend I'm walking by. By the way, I just happen to have this. Do you mind signing this? He'd be like, oh, Darko. Oh, you again. Oh, just sign it. Off he goes, right? But that's how we made the program work, right? So a lot of people, for example, in many latter years, I hear a lot of, oh, that's Botswana. It was a functional place. It was easy to do the program, right? And I was like, you have no idea. You have no idea. I had an easier time actually working in China, being Black and not knowing Chinese, than I had working in Botswana on that program in terms of just trying to get things done, right? And this is what I mean by the reality of implementation versus the shiny case study veneer you often see. A lot of the true nuances of what you have to do are really never spoken of.
It's what is said, life happened between the two milestones.
Yes.
And that is what is missing because people just saw the milestones. And this is something so important. So I'm going to go dig deeper because you mentioned the two things. What boiled down to, because beyond the intention awareness, we have to, so you're an interesting character, I must say, because you bring that, you obviously without understanding, a very smart decision you took because you have this medicine background and you needed that about the systems and the management and the out-of-box thinking. And you said it so rightly, you needed to come from the private sector, even think that that was possible. A government person would have just stayed in that box because somehow boxes are made and people then stick in those lines of the box. They don't know what is outside the box.
And by the way, in government, you literally are not allowed to operate outside the box in government.
So that was exactly where you learned that. And so now I need two things. One, for me, it was very clear when you mentioned this about it would not have happened in China. It happened in Botswana because it was a particular culture, the culture of the people and the work culture. And you came from another work culture. Exactly this, what you mentioned. And you built up trust. And when we talk of intercultural, what people now, I learned over the years, after 35 years of whatever, I suddenly realized working across continents after 30 years, I suddenly started laughing one day when I did some intercultural training. Then I realized, oh my God, all these experiences had a label. And what you just said, trust. So in intercultural interactions across continents, trust, awareness, observation, the foundation of whatever one has to do instead of jumping to conclusions and on judgments. People coming from another culture, like you studied and worked in the US. Now let us go down that road.
Yeah, and in a way, I think my upbringing, in a way, also maybe helped a lot because my parents are from Ghana. Born in the US, yes, but I left when I was 4 years old and I grew up in Tanzania and Kenya. So I've always been like a third, fourth culture kid. I really don't have quote unquote a home. So, and then subsequently, I've lived in the UK for a little bit, lived in Botswana, I've lived in South Africa now for the last 19 years. So having always been a foreigner, basically, right? I'm always a foreigner wherever I am. I think I was forced to develop that muscle, that set of muscles of how do you integrate, right, and because I'm never in quote unquote my culture. You know what I mean? In Kenya, there's like maybe 30, 40 major tribes and how many 100 languages and whatever. And I show up and I figure out very quickly what are the dynamics, how to belong, but I don't have to partake in, for example, the local rivalries or the local intergenerational issues these tribes have or whatever, because I'm from the outside. So I have this very unique vantage point, so to speak, where I'm an outsider, but I know how to become an insider very quickly, right? So, for example, the Botswana example, after a while, I think people literally forgot that I'm not part of government, right? I was in meetings that even local people are not allowed to with the president, et cetera, and I'd really get integrated, right? And so for me, that skill set really helps a lot when you're working in an international way across boundaries. Whether I'm in China, I can very quickly integrate there, despite not speaking the language, right? And despite being Black. And where I'm working in Europe or I'm working in most African countries, I understand very quickly how to pick up the social and cultural cues and pick up the dynamic and really figure out how to, in a very respectful way, integrate and be trusted as part of their team, right? But also the beauty I found is to have also that element of neutrality where, again, that helps with the trust because sometimes you find in many of these environments, many of these groups don't trust each other. And again, it's multi-generational things going on often in terms of tribalism or whatever. So being that bridge is often also very, being that outsider, insider is also, it gives me an advantage in many cases. So to your point, that ability is really important. And for example, when I'm looking at staff members for our company, Broadreach, who I look for that skill set. I look for those people. And it's not about color or race or gender or whatever. It's just it's people with a certain orientation and ability who show up and can engender trust really quickly. Because I know without it, you're not getting much done. You may think you are, but you're not.
Oh, that is so important because it boils down to attitude, open, non-judgmental. And so you carry that sense of, okay, I'm going to be a fly on the wall. You're just going to observe first. So, and I totally understand because it boils down to ability first and then skill sets, because skill sets can be taught. So some of the skill sets can be taught, but some of that orientation, there has to be a bit of ability, be actually in that ground. Otherwise, you can, as you said, I think I go back to the examples you used. You can't expect a cheetah to do whatever and an elephant to fly or
Exactly.
so.
But also, you can imagine, like in that example, the cheetah and the elephant going on the journey together is a very effective pair.
Yep.
Because when you need the fast running, the cheetah can take care of that. When you need the heavy lifting, the elephant can take care of that. So that's, to me, the beauty of the public-private model.
Yes,
Get it
I'm
right.
so with you.
And unfortunately, most people don't get it right. Sadly.
It's actually, from where I see, and I'm so glad we're on the same page, it's about working with strengths. This is your strength, this is mine. How do we combine both the two and come to it? And here, this is our objective. How should we just get to that? Get along. We don't look for weaknesses, we look for strengths. So,
and the other thing I try, and I question myself now whether it is the right approach or not, but also being willing to give away all the credit. Right? That was also really important in those partnerships, because often the private partner then tries to shine more or ends up de facto shining more than the local government team, right? So I was very big on making sure that it's the local team who felt like they did it, even though we did a lot of the heavy lifting, always sharing the love, sharing the credit, sharing the accolades, sharing basic things like who gets to present the results at the conference, as opposed to it being about me, and look at all the stuff I've done. It's very deliberately also giving credit to the team, right, and making sure that they are feeling that sense of accomplishment, that sense of that and then make them willing to do more. Makes them willing to invest more in getting better, because in normal government, there's really no incentive to get better. Right? I would say in a typical government public sector setting, your salary doesn't change based on your performance each year, right? I could come in, play on YouTube all day on my laptop or play solitaire. By the way, solitaire was the bane of my existence back then. Everybody used to play solitaire on their laptops, so it drove me crazy. One weekend I came in and removed solitaire from all the laptops, and I had almost a riot that Monday morning. And the fact that people felt empowered enough to actually riot about you remove solitaire. I'm like, why are you playing solitaire during the workday? But it's really critical to understand the dynamics of how these teams work, what matters to them, and make sure that they are getting credit for certain things and feeling, because in this context where no matter how I do my job, nothing changes about my life in terms of my pay or my status or my title or whatever, to get somebody to say, I'm going to do better today, right? I'm going to work harder. I'm going to put in more effort. What I found is you had to really play at a very deeper level, to make you feel proud of yourself, right? Or you have to tap into those kinds of things, and I have to give you a taste of what it feels like first. And then maybe I've got a taste, now I want to do more. And so for example, my team that started out as a typical, very sleepy, I'm waiting till 4 o'clock for the clock, became this highly functioning team. It was beautiful to see how the team evolved over that time. And they became so proud. They show up in a room and everyone's like, oh, they're part of the team who are launching, you could see them really eat it up, right? Because here they were delivering good results, saving their country, right? All of a sudden they had stature and status when they walk into a room, and therefore are willing to do that little bit extra, stay beyond 4 o'clock, answer that email at night because it's a crisis, etc. Otherwise, it's like, I'm done, right? Because there's no rewards for those kind of things. So again, you figure out how to hack the psyche in this, what I call, it's a closed environment in terms of how you're allowed to reward people, all right? And you have to then still figure out how to activate the right incentive behavior, right, within this group. So when we talk about working with public sector, again, that becomes a whole art form of how you do that within the confines of what you have. Private sector, I've got so many more tools in my toolkit to do that. Whereas in public sector, yes, you can have the carrot or the stick, but the stick only gets you so far. I always say in government, they have 1,000 ways to kill you without you knowing you're dead, right? Like, they're so good at sabotaging you if they don't want you or they don't like you or they don't want something to happen, right? In fact, I always say, which is actually not really a joke, is that if I want to really kill you, I tell you the right way to do things in public sector. Write a letter to the permanent secretary and knowing that's going to take you 10 years of being spun around and nothing happens. Whereas I know the really right way to do it, the way that works, is this way. This is the way you do it, right? So what I found is so critical to really understand the dynamic, understand how people work, and more very importantly, figure out how to make them feel good about themselves and their lives and what they're doing. And then you get them to really perform better and to do more. But again, it takes time. That's the other factor, in particular doing this type of work, that interface between public and private. Where the private sector often just, I think, gets it wrong in PPPs is they don't allow enough time for trust building And then they don't allow enough time for what I said, all this kind of like working with the government team to really raise their level. It's not, it doesn't happen because people fall in love with the idea and the imperative and, I need to save my country. When I'm here feeling underpaid, and by the way, I can see my desk mate who does no work getting the same paycheck. In fact, they got the promotion and I didn't. It's very, very difficult to create the right behavior. So often in the private side of PPPs, they're more like first quarter, where's the results, right? And sometimes some donors similarly. I want the Q1, what are the results? As opposed to understanding, it takes some time to really get in. Usually I'd say about a 12-month period of getting in, building the trust, getting that in those initial capacities in place and mobilized. And then you start to get a little bit of that exponentiation hockey stick effect from year one on out. But in my experience, if you want to do it right, you have to have a long-term view, come in knowing that year one is really more about getting entrenched, getting it right. And then you start to basically turn up the gears after that. But often I find it's, get in there in Q1, I'm already expecting linear results per the plan that we wrote. And then it usually just falls apart, because as I said, with government in particular, you're dealing with a group whose incentive structure is very structurally constraining them into a certain behavior set, which is not their fault, by the way. It is not their fault, but it is their reality. In the same way that I always say with any of us, you could just not wake up in your current job right now and do whatever you want, right? So, for example, if you worked at WHO, right, you cannot just wake up at, let's say you're a middle-level manager at WHO, you cannot just wake up in the morning and go to USAID and commit WHO to something. You can't, right? So that's the same reason why I could not meet with the guy from local government, right? I cannot go because I'm technically committing one ministry to another, right? I'm committing my entity to another entity. That's why it has to involve my permanent secretaries, right? But often in private sector, we don't understand that. We're like, oh, they're inefficient, and why do they have all this protocol? But in our world, you still can't do that at our level, right? Yes, there's other more efficient ways of communicating. However, in principle, it's still the same thing. You operate, especially when you're below the senior most level, you have constraints, and even those senior most people have constraints. So by understanding their constraints and then figuring workarounds that you basically are still technically working within the framework, but you're making things happen, I found is a much more effective way to go, i.e., redirect the current flow of the river or slightly or massage it as opposed to trying to head on fight it. So I'll give you one quick example. Very, very first meeting, Ministry of Health of Botswana. We're waiting for the meeting to start, and the minister was going to chair the meeting. And I can see the meeting not started. We're like 45 minutes late. People are buzzing around, looking a little bit stressed about something. So I turned to my deputy, who was a ministry person, and I said, what's going on? And he is like, well, for the meeting to start, the minister has to have a chair whose back is higher than every other chair in the room. And we can't find a high back chair, so the meeting can't start. And they're running around the ministry trying to find a high back chair for the meeting to start. So the meeting started almost an hour late. Finally, they found the chair, we brought it in, and then the minister walks in and does the meeting. And I'm like, here I am coming from New York, McKinsey, by the way. I'm sitting in a meeting like, oh my goodness, this is what it is. So one thing is you could sit there and be like, this is ridiculous. Let's stop this high back chair nonsense. And alternatively, like, well, let's just make sure there's always a high back chair handy just before the meeting.
I'm totally with you. And because it completely works. Yeah, it completely works against the system of wanting a solution. You want a solution. Oh, this is it. So what I've learned in life is there's an is. What is? What should be is another story. What could be is now, look, I've learned a lot. Or people say I speak in metaphors, but it's a beautiful. I love this because it's not only, what I see is that it turned out not only a foundation stone for you as a human being. I think, as we say in philosophy, it turned out to be your karmic ground where you were working out and your learning ground. And I think it's a fantastic model for many things in working fundamentally at collaboration between people, communities, nationally, internationally, it all begins from that one space where I love it because we seem to be on the same page, we working with a we instead of an I. And I always say that I is very small, makes you very small, your power small. And the moment you come, even your own working style changes, your thought processes change, you are no longer a very small person. You are big. Lends you that much power. And I think you've worked with exactly what I believe in with you're trying to see how you could give belonging and dignity and respect, building trust. And you are working not in a top-down approach, you are working with a bottom-up approach, building up motivation. You are working with people. So I always have another model in my brain. I've built a model where people work with 3 Ps. I always break it down to that nowadays, observation. The world works with profit, processes, people. And there's another way to work. People, processes, profit.
It's all about people at the end of the day. It's all
so
about
you can
people.
look at which is your vision, but as long as it is married to the people and then work out processes.
Yes. In particular, if you actually want it to work and actually want
intention.
you wanted to actually get it done as opposed to look like you're getting it done.
I know. It all boils
or
down.
Feel, and so much isn't actually happening because of this factor, right? So much is not actually happening because of this factor. That partnership you mentioned, that respect, that listening, doing that truly at community level, right? We're getting to the point where they, as a community members, are able to articulate the same priority set that you want to be the priority set. That makes sense? I would say, for example, when we go out to our communities, and in particular the rural areas, and you'd ask the local, we're here to implement an HIV program or diabetes program or whatever, and we've got the funding to do it, and we want to do all these great things. And then you go to the community and you say, what are your problems? And in the first 10 things they say, none of it is quote unquote healthcare. None of them say, my priority right now is to fix the thing you are here to fix. Right? And then most cases, I'm still going to proceed and go ahead. And my point is, it's not about dumping it on people. It's about maybe talking to them differently so that ultimately you both arrive at a joint common understanding of actually how this thing fits in, right? How diabetes is affecting your community? How does that interrelate with the problems I'm hearing you articulate right now, right? And making them see the connection and see why. I see why you're saying that's really important for us to do, right? To see how HIV is destroying the social cohesion, or HIV is destroying their ability to work in the farms or whatever. But if you don't link it to something that they then also understand as a priority, why do you wonder why they don't prioritize it and it fails? Which goes back to me. So one of the fundamental things, and I mean, I've said it for a very, very long time, is in healthcare, what we call healthcare is not healthcare, it's sickness care, right? So often we'll talk about clinics and how many doctors and basically the supply side required to address disease and infirmity, right? But we're not talking about keeping people well, right? And by the way, doctors are notoriously bad at telling you anything, articulating, by the way, this is what keeps you well, right? Should you do yoga 3 times a week or whatever? No doctor is going to talk about it. No doctor can talk to you about nutrition. Very few, if any, can talk about nutrition, for example, and the right nutrition. They know how to treat you for your maladies, right, for your illness. So for me, what ends up happening is, therefore, in this framework of healthcare, right, we have this premise, therefore, that when you look at a health plan, it's about building more hospitals, hiring more healthcare staff. How are we going to build this supply side infrastructure to address the disease? And to me, every time you need to build a new hospital, that's a failure. Every time you need to hire a new doctor, that's a failure. So we have basically anchored ourselves to failure metrics and call them success metrics. We've built a lot of good truths on top of lies.
Right? Fundamental.
So
yes, I'm so glad you said that.
Right.
Building hospitals is a fail. You hit the mark.
Right?
Perfect. Yes.
Yeah. So a sign of success should be, I've had to shut down my hospitals. There's not enough business for them. That would be success. Healthcare, keeping people healthy. But we're not. We're accepting also that healthcare is treating disease, which is basically the lie. And then now the truth is, yes, I need more doctors. That's true. I need more doctors. I need more hospitals. I need more drugs. But these are truths based on lies, right? And you find this repeated over and over within this sort of public health social space where there's a lot of these truths that now we're running top speed to implement these things, but we're based on the fundamentals that are rotten, right? That are not really true. And therefore and then we wonder why we still have persisting problems, right? So that's one. And by the way, when I talk about really changing the fundamental model towards actually keeping people well, that's a whole other conversation, by the way, right? And there's very few incentives really for people to do that. But that said, how are you going to actually have healthcare when fundamentally this person you're talking to doesn't appreciate their health, right? And even you and I sitting on this call, we don't appreciate our health. We don't. You know why? If I give you $10,000 right now, you don't go buy more health insurance. However, if you or I on this call found out that I have cancer or some really serious disease, I'm willing to sell my house now to go and get myself treatment. So we value as the B2C, the C side, the consumers, we value our healthcare at 0 when we're well, or in fact, negative. And then we value it at infinity when something goes wrong. That's a very dangerous dynamic to try and program against. A very difficult dynamic to try and address, right? So what happens is when I come into communities talking about my healthcare intervention, already I'm coming against a backdrop of it's not something they intrinsically say, I see the value of what you're trying to do. They'll see it if they're sick already, right? And they're acutely feeling it. But they won't see it from the perspective of, oh, you prevented me from getting there. I appreciate, therefore, I'm going to spend my time, effort, and resources in preventing something from happening. And then worse yet, like we saw with COVID as a really recent example, when COVID hit, we're going to spend trillions of dollars. Now you can barely raise $1 to support pandemic preparedness. Already the appetite is 0 to support stuff, right? Let's support things that are actively in crisis as opposed to preventing them. So from an individual level, there's that sort of mindset. Systemically, we have that mindset as well. And therefore, positioning what we're really trying to do, again, takes on an element of really having really deep work that's required to position these things so that there's that innate appreciation for why I'm doing it, why I'll maintain it, why, for example, as a local village leader, I will executive sponsor this thing. I will make sure my community is partaking of this thing or whatever was agreed in the program on an ongoing basis. And it's not Ernest who has to fly in and drive 3 days to the village each time to try and keep prodding people along to do the things that are required. Because a model that is based on me having to come in and prod you, it's not sustainable, it's not viable, it doesn't even work, right? And a lot of it starts with, for example, us not adequately appreciating our healthcare enough. And that's the foundation. And then on top of that, having the resources to, if I do care about my healthcare, having the resources to do something about it so that I stay well. When I get ill, which should be a rare occurrence, having then the curative supply side infrastructure in place to address my needs, right? But we start with the curative supply side chain and let's grow the hell out of that. And it's going to solve all of our healthcare problems. And we believe that's going to work somehow.
Actually, what you mentioned is very, very important. And that is something which is the bottom at what should be completely. It has to be, how do you call it? Chicken and egg? No, it's not even a vicious cycle. So one has to break out of that. And you said something which triggered, I have this brain where I keep connecting whatever. Till something happens, you don't give any importance to it. And I think that is a basic human nature because look at the subject of death. One may not wake up tomorrow. And people want to just avoid the subject altogether. Knowing mortality, people live life as immortals. Actually. So this is, I think, mental ethos. Having said that, how did you manage to create the awareness? Everything had to be built up with the resources, non-availability. You looked at what was and figured out what could be. and what finally is. How did you build up awareness in the people? Because that is about mentality. Dear listeners, leadership and trust set the stage. But awakening a whole nation? That story unfolds in our next episode. Stay tuned.
Thank you for listening to the series Between the East and the West. Do subscribe to the channels mentioned on the site in case, of course, you liked what you heard. I am Meenu Gupta, the host of the series, and I'll be looking forward to your comments. We love feedback. Thank you once again. Namaste and bye-bye.